Well, the coronavirus is a respiratory illness that mimics symptoms of a cold or the flu that can range from mild, as we know, to deadly. I had a chance this afternoon to chat with Kurt Merriman with RT Now, a company created for decision makers in respiratory care specifically, on what he does and his colleagues and what they're seeing with this virus as it spreads and how telehealth is playing a vital role. Kurt Merriman is the Chief Sales Officer with RT Now. And before we get into how RT Now is doing some work or important work with coronavirus, let's talk about what it really is, first of all, Kurt.
We are a telerespiratory organization, and we provide licensed professional respiratory therapists to organizations that may not have access to a respiratory therapist 24/7. We started out primarily working in rural America, where smaller hospitals may not have a respiratory therapist available to them 24 hours a day. We also work with skilled nursing facilities that, again, may not have access to a respiratory therapist as well.
This is relatively new. You all started in, is it 2016?
That is correct.
Tell me how what you're doing and what you have been doing could now benefit in what's going on with coronavirus. Every day something is changing with this. We
can access patients in their homes. We can be available to facilities that may be short-staffed and have limited resources because of the COVID-19 and their own staffing levels. And the therapist can actually do this from the safety of their home environment without being exposed to anything. And yet we can still help assess patients at the bedside. We can troubleshoot high-tech ventilator equipment that they might be on and make recommendations, do troubleshooting and assist the caregivers that are actually at the bedside. One of the things that we've developed is that we have a part of our service is called CoreLink. So an organization, if they did not want to use or need to use our respiratory therapist licensed staff, is that they could use the software for their own staff to be able to send a text or an email to a smart device to maybe a patient in their home that the respiratory therapist or other healthcare professional could help do some screening to see should they actually come in to a facility for more testing.
Okay, let me cut in right there then, Kurt. I have someone in my family right now who has had an upper respiratory infection. Went to fast care recently, wasn't tested for the coronavirus, but just basically sent home, no antibiotics or anything else. So with what you're doing, how would you be able to help in that situation? Because for the most part, I'm thinking people who are having problems need to see someone.
We could help screen using that technology to be able to actually see the person in their home. There's a lot of people that have smart devices, whether it's a smartphone, a tablet, iPad, or a computer system. So we'd actually be able to do a HIPAA compliant, so we're masking any problems with sharing data about that particular person, even doing a video chat. So we can see that individual and ask them the questions to find out how they're feeling, what their symptoms are, to see should it be elevated, should they actually contact their physician or medical facility to actually be seen, or can we just assure them that their symptoms are not necessarily falling in line with what the CD recommends and is saying for screening for COVID-19.
Okay. Kurt, I'm going to take a quick break. I have a couple more questions that I want to ask you, so we'll be back in just a couple of minutes, okay?